the basics.
It's 4:30 p.m. here in Seoul. I'm Devin Whiting at the Arirang News Center, and we're now bringing you the latest live briefing from the South Korean health authorities. Looks like that'll be beginning shortly, and we'll go straight to it when it does. We'll be getting the latest figures, so let's listen in.
Good afternoon, everyone. I am Young-rae Son from the Ministry of Health and Welfare. We will start the regular briefing for today. Today's briefing will be presented by Minister Bang Neung-hoo. We also have Chang-ju Lee present, and we also have Ho-sung Kim from the Ministry of Commerce. And also we will be presenting the sign language translation. First, we will hear from Minister Bang Neung-hoo about the countermeasures against COVID-19. I am the first Vice Head of the Central Disaster and Safety Countermeasures Headquarters, Minister Bang Neung-hoo. As of October 4th, there were 47 community cases that were newly confirmed. And also, we were seeing 12 cases from the non-metropolitan areas and 35 cases from the metropolitan area. One person passed away yesterday. We pay our respect to the deceased, and we also pay our condolences to the family members. After the spread of COVID-19, we had the first Chuseok holiday, and it is coming to an end now. For the safety of ourselves and for family members, many people refrained from going back to their hometowns, and many people actually paid their greetings through phone calls. And even if they went to the hometowns, a lot of people strictly follow the rules on disease control in many places such as rest stops. We had fear that this would be another trigger for another cluster outbreak, and we also had fears for the National Founding Day gatherings, and we were able to see it actually coming to an end without too much trouble. So we want to pay our gratitude to our citizens who actively supported us and followed with the guidelines. The government will also make sure to pay more efforts until the end of the Chuseok period, and we also did strict monitoring together with local governments. Especially for the Gangwon-do provinces and Jeju-do Island, we had sent more troops there so that we could increase the disease control measures, and we also strengthened disease control measures as well. And for many transportation sites and other sites, many personnel were able to help us, and we thank you for helping us despite it being a holiday. For the Chuseok holiday, we did not see the trouble that we had feared for, and we were able to see the concerted efforts made by the citizens of Korea once again. We want to thank you once again for all your cooperation. In Korea, for the community spread, we are able to see a daily average of under 50, so we are seeing a continuous decrease. Especially for the past 2 weeks, we were seeing a daily average of 66.5 people were newly confirmed, and this is a decrease compared to the number being over 100 in the previous 2 weeks. And during the Chuseok holiday, the daily average of newly confirmed cases was 57.3, so we were seeing another decrease. However, we have to consider the spread of COVID-19 that could come about after the holiday period, so we will only be able to make a clear assessment around 2 weeks later. However, considering that those of unknown cases at 19% and considering that the spread is still happening in hospitals and schools, we still have to see that there are concerns. And considering all of this, we have to say that COVID-19 is not fully stabilized yet. So we still have to make sure that we are taking caution. After the holiday, we still have another holiday coming on October 9th for the Hangul Day, and this will continue until October 11th, so we will have the strengthened measures until then as well. So with the social distancing, many people are probably feeling tired, and there are people who are being harmed in terms of their businesses. However, how we spend this Chuseok holiday is the determining factor for the COVID-19 and its spread until the end of the year, so we want to ask you to bear with it until then. After the special disease control period, we are going to make a decision about what to do, and this will be based on the assessment that we make comprehensively with the risks that we see this week as well. And I will now talk further about wearing face masks. With the new and revised act, we have come up with an administrative orders for wearing face masks. And we have also strengthened measures for paying fines. And this will be put into force on 14th. So we have come up with specific measures about payment of fines. And we are also making the wearing of face mask mandatory. And this will be differently applied depending on the risk of facilities. So for the multi-use facilities, this will depend on the business owners and the employees. So this will be applied in a stepwise manner. So there are also public transportations and gatherings and demonstration sites where a lot of people gather, and there are also medical care facilities and hospitals. And for these, it will be mandatory to wear face masks regardless of social distancing measures. And the masks include KF94, KF80, and also those that are blocking salivas, and also surgical masks as well. However, for those that made out of nets and wearing scarves to cover your face is not considered as wearing face masks. And for eating and having concerts or playing sports, there are also some exceptions. So we're going to come up with some strict and detailed regulations for these as well. And we're also going to accept opinions from our citizens. So we're going to have a pending period until the 12th, and afterwards, people who violate this will have to pay fines. Please look at the press release documents for more details. So face mask is the most protective measure that we can wear to prevent the spread of COVID-19 when we don't have a vaccine yet. And payment of fines is a measure that we are taking so that we can have more people wearing face masks. And we also have to make sure that this is deeply rooted in our societies. And for this to be possible, we need to ask for your cooperation. Wearing face masks is a consideration that we can do not only for ourselves, but for the safety of those around us. So these days, we are seeing a stabilization in newly confirmed cases. And for the life treatment centers, the operation percentage has come down to 7.7%. So we have also talked about operating this in an efficient manner. So we're going to make sure that the capacity will be maintained at 30, but for those facilities that are not in use, we're going to close them down in a gradual manner. However, if there is a re-outbreak or resurgence, then we will also be operating these facilities once again. And we will also make sure that we come up with preparatory measures so that we can operate the facilities at any time when there is an increase in newly confirmed cases. And we are going to make sure that we can operate these facilities in a stable manner. Next is about the Korea Sales Festa and the disease control measures regards to it. For Korea Sales Festa, this is to encourage domestic demand and boost up the economy in the current situation where we see an economic downside due to COVID-19. And this will be carried out in an untaxed manner, and we're going to minimize any offline events. In addition, we're going to have some guidelines depending on the level of social distancing. And when there is an outbreak, we could also convert the offline events to an online event or cancel it. So we're going to make sure to monitor in a strict manner. And for any local events, we're going to have personnel in charge, and we're going to make sure to have untaxed operations such as drive-through sales. So we're going to strengthen any disease control measures that we can. However, at the same time, we want to make sure that we boost up the sales for the business people. So we're going to make sure to strive very hard. So COVID-19 is even changing the traditional practices that we have had in our holidays. So there are parents who have said you don't have to come back home for the safety of their children. And many people pay their greetings through the phone calls instead of visiting the elderly. So I feel apologetic that people had to do this, but I am also thankful at the same time. However, the special disease control period for Chuseok has not ended yet. So we still have to see how the influence of this holiday comes about. We still have to see about that. And also we have another holiday coming up on Friday, and this could continue until weekend. So we have to see the influence of this as well. So we have to see how it goes next week to see the influence of the previous 2 weeks. So we want to ask you to continue to follow with the social distancing measures until next week. Please refrain from visiting confined spaces that are crowded, and please make sure to follow guidelines on disease control at all times. So it is important for every single citizen to feel that you are the one in charge of preventing and containing COVID-19. And if you do so, we're going to be able to curb the spread of COVID-19. At the same time, the government will also make concerted efforts so that we can work with you. Thank you.
And that'll conclude our coverage of this briefing. Thank you for watching. Arirang News will be back at 6 p.m. Korea time.
January 2020. The sudden outbreak of COVID-19 made us part with our daily lives. Traveling with family and friends, music concerts, art exhibitions, and the days when we would go outside without a mask. Like all farewells, parting with our lives that we once took for granted has been tough for every one of us. Beyond the daily lives that we miss, we are now creating a new life where we come together as we support each other and build solidarity.